Alcohol and a creatively active life, alcohol and a strong family, alcohol and health are incompatible concepts. This is irrefutably evidenced by sociological studies, numerous experiments and clinical observations, as well as real-life examples that each of us has probably encountered more than once. True, you can often still hear objections from doctors, who, as a preventative measure, have exaggerated the harm of alcohol too much, and are intimidating just in case. It is difficult to convince such people, who trust only their own painful craving for alcohol. Moreover, the process of the destructive effect of alcohol, on the body and on a person's personality for a long time, can be hidden not only from prying eyes, but also from the drinker himself. All organs and systems of our body suffer from the effects of alcohol. This fact is beyond doubt. It has also been proven that the central nervous system and liver are the most vulnerable. Why is the liver a target for alcohol? What consequences do the changes that occur in it threaten the body? Before answering these questions, let us remember some physiological and anatomical features of the liver. This is the largest gland in the body. It produces bile, which is so necessary for the digestion process and proper metabolism. The liver is responsible for truly titanic work. It processes the vast majority of fats, proteins and carbohydrates that enter the body with food, and neutralizes toxic substances formed in the body or coming from outside. Moreover, the liver is also a repository of the so-called reserve carbohydrate glycogen, vitamins and other substances. It is located on the paths that carry blood from the stomach, intestines, pancreas and spleen to the heart. This means that all substances absorbed from the stomach and intestines into the blood, before entering the general bloodstream and reaching the body tissues, inevitably end up in the liver. Each liver cell is a miniature chemical plant that receives and processes a large amount of various raw materials and produces numerous products necessary for the normal functioning of the body. By invading a cell, alcohol disrupts the technology of processes occurring in it and deforms its structure. Ethyl alcohol is precisely what is included in all alcoholic beverages. Its chemical characteristics are a rather simple and easily oxidized substance that dissolves fats well. From the stomach it is quickly absorbed into the blood and delivered to the liver. Liver cells contain an enzyme with the help of which the first link in the oxidation of alcohol and the beginning of its combustion is carried out. Here a very unfavorable situation arises. The liver is forced to spend part of the oxidative enzymes necessary for normal metabolism on the breakdown of alcohol. As a result, the finely balanced metabolic processes in the liver cells are disrupted. Scientists have found that even a single dose of large doses of alcohol does not go away without leaving a trace. Within 2 to 4 hours, droplets of fat, brought by blood saturated with alcohol, appear in a significant part of the liver cells. At first these are quite small single balls, but gradually there are more and more of them. Merging, they increase in size and occupy most of the cytoplasm of the cell, displacing glycogen. In addition, part of the glycogen is used to burn alcohol. The accumulation of fat droplets leads to an increase in the size of liver cells. The intracellular structural components of the organelles, which play an important role in the life of liver cells, are deformed. In addition, despite the overall increase in the volume of each cell, the accumulation of fat reduces its useful working area. It is quite clear that such a cell is not able to fully fulfill its many responsibilities. The higher the alcohol concentration, that is, the strength of the alcoholic drink, and the greater the amount, the more significant the changes in the liver. In a healthy body with its high compensatory abilities, these disorders are gradually normalized, but not immediately, not earlier than in a week and a half. You can imagine how hard it is to suffer liver from systematic attacks of alcohol. She not only does not have time to recover from fatty infiltration, on the contrary, this process takes over an increasing number of cells. The first phase of liver damage is obesity. At this stage, it is still possible to achieve partial, and sometimes complete normalization of the structure and function of the organ. It is possible if you completely give up alcohol and undergo a course of long-term treatment. The decisive role is played by the time factor. The less experience of alcohol abuse, the less alcohol consumed, the greater the hope for recovery. If a person does not find the strength to overcome his addiction to alcohol, a moment comes when the liver cells, unable to withstand the constant overload, die. Everyone knows that any serious damage to the skin or muscles ends in the formation of a scar. This ability of the body to fill defect with connective tissue is universal and extends to all organs. A similar process develops in the liver, where cells dying under the influence of alcohol are replaced by connective tissue, and liver scarring occurs. This is how the second phase of her alcohol-induced cirrhosis develops. Unlike obesity, this process is irreversible. Scientists are looking for ways to stimulate the reverse development of connective tissue formations, but there are no tangible results that can actually be put into practice yet. Cirrhosis is characterized not only by a decrease in the number of liver cells, but also by its anatomical structure. Connective tissue strands deform the hepatic lobules, dramatically disrupt the architecture of the vascular bed, thereby significantly complicating the passage of blood through the liver. Therefore, with developed cirrhosis, significant disorders in the system of blood transport from internal organs to the heart are added to the decrease in specific liver function. And if the capacity of the liver has decreased, blood inevitably accumulates in the veins of the stomach, esophagus, intestines, pancreas, and spleen. The lumina vessels filled with blood expands, its circulation slows down, and the permeability of the vessel walls increases. These changes are very dangerous. The liquid part of the blood, plasma, is released into the abdominal cavity, forming the so-called hydrocele. In turn, the prerequisites are created for rupture of the walls of blood vessels, internal bleeding and damage to other organs and tissues of the body. It should also be taken into account that in people who regularly drink strong alcoholic drinks, the mucous membrane of the stomach and intestines is damaged, which means that the processes of processing and absorption of nutrients are disrupted. Due to general intoxication of the body, alcoholics have a worsening appetite. Against the background of poor nutrition, especially if the diet contains few proteins and vitamins, the damaging effect of alcohol on the liver increases significantly. Alcohol is especially dangerous for liver diseases of various origins. Do not neglect the advice of doctors who in these cases veto alcoholic drinks, because even a small dose of alcohol puts an unbearable burden on the liver cell, which is already weakened by the disease. Against the background of multiple disorders caused by cirrhosis, serious disturbances in the functioning of other organs and systems develop. One of the most common complications is portal hypertension. It occurs due to obstructed blood flow from the abdominal organs through the affected liver. The pressure in the portal vein, which carries blood from the digestive tract to the liver, increases. As a result, blood begins to accumulate in the veins of the esophagus, stomach and intestines, causing them to expand and thin the walls. This condition is called varicose veins. Varicose veins are extremely dangerous, since internal bleeding can occur if the vessel ruptures. It is manifested by vomiting blood, tarry stools, general deterioration of health, decreased blood pressure and rapid pulse. Internal bleeding requires immediate medical attention, otherwise it can lead to death. Another common complication of cirrhosis is ascites, which is the accumulation of fluid in the abdominal cavity. It occurs due to an imbalance of fluid in the body. A liver damaged by cirrhosis cannot fully synthesize proteins, including albumins, which retain fluid in vascular bed. As a result, fluid leaves the vessels and accumulates in the abdominal cavity. Ascites is manifested by a gradual enlargement of the abdomen, heaviness in the abdomen, and swelling of the lower extremities. A large volume of fluid in the abdominal cavity makes breathing, movement and eating difficult. Ascites can also lead to infectious complications such as peritonitis. Against the background of cirrhosis, hepatic encephalopathy also often develops. This is a dysfunction of the central nervous system, which occurs due to the accumulation of toxic substances in the blood, usually neutralized by the liver. Hepatic encephalopathy presents with a wide range of symptoms, including changes in consciousness, confusion, drowsiness, impaired attention and concentration, tremors and seizures. In severe cases, hepatic encephalopathy can lead to coma and death. Drug treatment of cirrhosis is aimed at slowing the progression of the disease, eliminating complications and improving the patient's quality of life. Antiviral drugs are used to treat viral hepatitis, diuretics to remove fluid from the body in case of ascites, lactulose to reduce the level of ammonia in the blood in case of hepatic encephalopathy. In some cases, a liver transplant may be required, especially if the organ is severely damaged or irreversible complications develop. Liver cirrhosis is a serious and dangerous disease that requires timely diagnosis and treatment. Avoiding alcohol, following your doctor's recommendations, and following prescribed treatment can help slow the progression of the disease and prevent the development of complications. Thank you for watching. Go to my channel and watch more interesting and useful videos.